Hello there, my name is Jessica Steffens and I'm the Specialist Oncology Dietitian at Southend University Hospital. What do registered dietitians do? We are qualified and regulated health professionals who assess, diagnose and treat dietary and nutritional complications. We stay up to date with public health and scientific research on nutrition, health and disease, which we apply to provide personalized advice to educate patients. And we work in a wide range of specialities in a variety of settings. Why nutrition is important in oncology. Healthier diets can help prevent up to 30% of cancers in the UK. Eating well and keeping a healthy weight will help you feel stronger, increase your energy levels, keep your immune system healthy, improve your sense of well-being, and it can also help to reduce your risk of new cancers and other diseases such as heart disease, diabetes, and stroke. So what does a healthy, balanced diet look like? A balanced diet will provide you with all the nutrients that you need to stay healthy. These include fruits and vegetables, which provide all your micronutrients like vitamins and minerals. Starchy foods give our bodies energy to perform our daily tasks. Proteins are important for our muscle development. Oils and spreads, which provide us with essential fatty acids necessary for normal bodily functions like heart health and cognitive function. Fluids keep us hydrated and are essential for normal kidney function. Lastly, salts and sugars should be limited and eaten infrequently. You can find out more information on this on the NHS website. Here you can see some examples of the food groups mentioned on the previous slide. So for fruits and vegetables, we aim to eat at least 5 portions a day. A portion is 80 grams or any of the following: 1 apple, banana, pear, orange, or other similar sized fruit, 3 heaped tablespoons of vegetables, a dessert bowl of salad, 30 grams of dried fruit, or 150 ml glass of fruit juice. Starchy food examples are bread, cereals, pasta, rice, or potatoes. Whole grain bread, pasta, and cereals, and brown rice are a good source of fiber. Our proteins include beans, pulses, fish, eggs, red meat, poultry, or tofu. For fluid, we aim to drink 6 to 8 glasses of fluid every day, and examples of these are water, tea, coffee, milk, and even soup and yogurts. Saturated fats come from animal sources, and examples of these include cheese, butter, sausages, burgers, biscuits, and chocolate. And unsaturated fats come from plants or fish sources, and they are the healthier fats, which you should try and include more of these in your diet every day. Examples include olive oil, avocados, almonds, peanuts, salmon, and mackerel. So a bit more on fluid, you do need to aim to drink at least 2 liters of fluid every day, and more if you are active or if it's very hot outside. Water is the best way to keep your body hydrated. If you struggle to drink water, you can add water drops or squash to improve your water intake. Milk is also a great source of calcium and it's good for your bone health. Fruit and vegetable juices contain a range of vitamins and minerals, but they also contain a lot of sugar, so aim for 1 small glass a day. Fizzy drinks also contain sugar and very few nutrients, so avoid drinking large amounts. Alcohol is very high in calories and it has been linked with increased risk of some cancers. The NHS suggests not drinking more than 14 units a week, and it's a good idea to spread out your alcohol intake and have several alcohol-free days. Alcohol should be avoided whilst undergoing anti-cancer treatment. Some potential side effects of cancer treatments include tiredness, nausea, loss of appetite, diarrhea, excess gas, as well as strength and muscle loss. Managing these side effects. If you experience nausea, try eating smaller meals or snacks often to avoid feeling full. You can also try drinks and snacks containing ginger, like ginger beer or ginger biscuits, which helps to speed up your stomach emptying. Peppermint sweets or drinks like peppermint tea can help, or if you suck on ice lollies and sip cold drinks. For loss of appetite, try a little and often approach to eating. Healthy, nutrient-dense between-meal snacks and food fortification, which we'll look at in more detail on the next slide. If you experience diarrhea or excess gas, avoid alcohol, avoid having fatty and fried foods, follow a low-fiber diet, so limit your intake of whole grains, nuts, seeds, and skins, reduce spicy foods, fizzy drinks, sorbitol, which is your sugar-free sweets and gums. For excessive gas, you can try 1 tablespoon of linseed taken with 150 ml of uncaffeinated fluid, and also avoid gas-forming foods like beans and pulses. For loss of strength and muscle mass, we advise that you choose high-protein, high-energy meal options and snacks. So when we talk about food fortification, what we mean is adding certain foods to meals or snacks to increase the nutritional content without increasing the amount of food you are eating. For example, add whole milk, cream, syrups, peanut butter, dried fruit, honey, jam, and yogurt into porridges or cereals. Use full-fat spread, butter, nut butters, egg with mayonnaise or cheese on your toast. For main meals, add sauces, cheese and butters and oils into your meals, for example, adding cream, whole milk or cheese into soup and mashed potato. Fortify your desserts with ice cream, cream, yogurt, jam and custard, and add full-fat milk into your tea and coffee. Oral nutritional supplements. For patients who are unable to meet their nutritional requirements through diet alone, you may be offered oral nutritional supplements by your dietitian. They help to increase the energy and protein intake, as well as micronutrients. There is a huge variety of ONS available, including milkshakes, juices, yogurts, jellies, and even soups. There are a number of different ONS that benefit specific groups, for example, higher protein, fiber-containing, pre-thickened. It's always important to make sure you meet with a dietitian before starting oral nutrition supplements to make sure that you get the right one for your condition. Food fortification and/or ONS can enable you to keep up your strength and energy, maintain your body weight, lower risk of infection to heal, and recover faster and tolerate treatment-related side effects. Lycopene is an organic compound called a carotenoid. It is an antioxidant that gives tomatoes, red peppers, and grapefruit their pink or red color. Studies show that lycopene can potentially suppress the progression of prostate cancer, as well as reduce the side effects of cancer treatment. Although studies do not show that lycopene can prevent prostate cancer, low lycopene levels have been associated with prostate cancer. Cooking tomatoes in a little bit of fat like olive oil can help with the absorption of lycopene. Currently, there's no recommended daily allowance for lycopene. However, studies have shown health benefits when supplementing up to 45 milligrams of lycopene per day. So to conclude, maintaining a good nutritional status is important for improved clinical outcomes in a patient undergoing anti-cancer treatment. Following a balanced diet containing all your food groups is the best way to meet nutritional requirements. Oral nutritional supplements can assist in meeting nutritional requirements when food intake is a struggle due to the side effects of anti-cancer treatment. Ask your GP to assist with nutritional supplements, or your consultant can refer you to the oncology dietitian if further dietetic intervention is required.